Okay, so this is just a short video to explain to the family members what we do, and this is how I introduce each group on a Wednesday to the family members. So first of all, I give her outline of the program. So it's a 3-week rolling program. So that's week 1, week 2, week 3, and we go Monday to Friday. And on a Wednesday, the first hour is with the family members. And we create a container, we create a group, and the first week is about spiritual principles. The second week is the brain and the mind, and then the third week is community and growth. Okay. Now for our Dutch clients, there will be 2 cycles because they'll be here for 6 weeks. Okay, so that's the one thing. The next thing we talk about is a culture of learning, and the family members have been impacted by someone who was in a culture of addiction, and now the patient or their loved one has moved to a culture of recovery. So while they're here in treatment, we teach the patient about the culture of recovery. Now the family members, they have learned how to survive by watching the person they love descend through the use, misuse, abuse, and dependence. They've watched someone they love go mad. And they've been impacted by that. And what we teach them is about post-traumatic stress disorder. Post means after. Trauma is too much, too soon, too quick, being overwhelmed. Stress is what happens to the body, and disordered is the way that they are reacting or responding to that stress. So we start to teach the family members that they too need to start to work on themselves and meet their loved one over in a culture of recovery. So that's the framework, and all of this is surrounded in a culture of spirituality. So a culture of spirituality will be like honesty. So we need the family member to start to get honest about the impact that this person that they love has had on them, and to start to identify the feelings that they're feeling. So we've got the 5 core feelings. We've got guilt and shame, anger, sadness, fear, and joy. And this is what the family member's feeling. And the family member needs to know how to speak about that to start to repair the relationship. You see, they might have a lot of anger at the behavior, but they're too scared to express the anger because they're fearful that the person that they loved is going to go back to a culture of addiction. So we try and work with the family members to start the detachment process. And that's where the team supports the family from admission right through to reintegration. And that's what you do, Paula. So yeah, that's the short video. And I hope it's helpful, and you can start to explain to the family members the process that they're going through. So with our current clients, we've got, if we look at time, we've got a 17-year-old, who would not have experienced all the consequences that our 55-year-old client did. Now our 55-year-old client, his family need help. and it would be helpful for us if the family members get support, because it helps them process their feelings, and it makes it better for our clients, for the environments that they go back into. Yeah, so that's a very broad framework. Hope it was interesting.